Hey, how are you?
How are you? Good. How are you?
I'm good.
What's up?
I'm good.
Have you studied?
Yeah, but not all everything, but I studied the hardest part.
What do you mean not everything?
I went to the same thing like you did the same parts, but I read the chambers. So I didn't study chambers and the SA node and AV node. I
You
studied
didn't study?
I studied valves and these things.
No, okay. But did you understand the
Yeah,
chambers
yeah,
when we went through?
yeah, yeah, yeah.
SA node, AV node, did you understand it?
Yeah, yeah, I watched the video, but I meant I didn't memorize.
No, okay. Okay, good. Okay. When when is the next practice that you have?
Friday,
Yeah. How was the practice today? Was it today?
yesterday.
Yesterday. How was it?
Yeah, it was okay. Yeah.
What did you see?
Everything you listed.
Sure?
Yeah,
Everything.
yeah.
Sympathetic, thoracic
Sick.
duct, azygos,
The
vagus,
thoracic duct
phreni.
was not dissected. She said
But
thoracic duct was not dissected. She said next class we'll see the thoracic
oh,
duct.
okay. And you know your friend Payal.
Pile, yeah.
Yeah, she told me that your teacher said that we don't have time on the heart.
Yeah, we don't have
Yeah?
to. Yeah.
Yeah. Okay. If she said that, thymus is replaced by fat
By
in the
fat.
body.
Yeah, that's
Yeah,
what I
exactly.
thought. Maybe because it's fat, it doesn't make that
No,
impression.
we have the fatty impressions.
Okay.
So we have the impression, okay? But maybe she thought that, okay, we don't have time, so we don't have impression. But you said that you have the fatty impression, which is replaced by thymus. And in the book, you see the impression. Maybe in the lung, it's not really visible, I told you the impressions are not really visible.
Okay.
So how far did we go?
We have, you said we have only the arteries with vessels.
Okay.
I want to ask you, we have two cardiac plexus, deep and superficial.
We will go through it, yeah. We have to.
Okay.
Okay, we will go through it. Today we have to finish everything, okay?
Yeah, I want to ask you,
So-
what is carina in the lungs?
What?
Carina, Carina.
Say it again.
I will write it to you for you.
CAI, book, say it again. CAA.
Carina.
Yeah. Karina.
Yes.
In the lung.
Yes.
So let's see. Where have you...
What?
Where have you seen this name?
In
Where
the
did
class.
you find it? What did she say about it?
I don't remember. She said, I just listened to what she's saying. Like, if there's something like I don't know, I just write it on my note.
Okay.
So she said it and she showed in the slides. They have this slide from the atlas. She said, this is Karina.
In the atlas.
Yeah. In her slides, they have the picture as atlas.
So it says carina is a cartilaginous ridge within the trachea that runs in between the two primary bronchi. I never heard, but let me check what it is.
Okay. The pars flucida and pars dicta.
Yeah.
Can we see them in the specimen?
So carina, it says it's a cartilaginous ridge, okay?
Okay.
So here in the trachea, carina, I never heard. Here. So it's not the lung, it's the trachea.
I'm
Here,
not seeing
the
your screen.
Huh?
I'm not seeing your screen.
Oh, sorry. Do you see?
Yeah.
It says it is a cartilaginous ring here between trachea and bronchus.
Okay.
Here, do you see it says
Yeah,
carina?
yeah.
So maybe it's where the trachea is split into two main bronchi.
Okay.
It's a cartilaginous ring. What else did you ask? The pars tecta and pars flexida.
Yeah.
Look, is the aorta cut?
And
Do you
this-
know what I mean? Like here?
we have two hearts, one with the vessels, one without vessels.
Okay, so do you see the aorta?
Yes. Yes.
Here it has the valve.
Yes.
Okay? If you look from inside, it's a long way to see, so it's hard. But if they cut it, do you see if they make a cut here,
Yeah.
they open it. Some of the students, they told me it's cut and it's opened. Then you can see.
Okay.
Okay? If it is open, then you see something, this look. It's cut and it's open, then you see this.
Okay.
So if you see, then here is pars tecta, this is pars flexida.
Okay, where is the nodula and lunula?
Do you see these ridges here on side?
Yes.
So these ridges, two on each side for each cusp. This is lunul,
Okay.
and this elevation here is nudul.
Okay.
And inside the cavity is called sinus of Valsalva.
Okay.
Okay?
Alright.
What else?
That's all.
So you just heard Karina.
Yeah.
Okay, you, nothing else?
Nothing else.
Okay, good. So should we start now?
Yeah. Yeah.
Okay. Let's go through blood. Do you like record the screen, right? I turn my camera off. But just give it to Omar, no one else.
Okay.
Here, look. Let's start with the arteries. This is heart. Which view of the heart, which surface of the heart it is? It is anteriorly or posteriorly?
Anteriorly.
Yeah, it's anteriorly. Very good. What is this?
This one? Vena no. Which is vena cava?
Yeah, you know, orient yourself. This is apex.
Yeah, apex.
So this is left ventricle.
Yes.
This is left atrium. This is the right atrium. This is right ventricle. Okay.
Yeah.
So this is right atrium. It's through superior vena cava. What is this?
This inferior vena cava?
No, inferior. It goes from below.
Wait, no. This one it's the pulmonary
Yeah, it's
artery.
right ventricle, pulmonary trunk.
Trunk, yeah, trunk.
Okay, what is this?
This one pulmonary vein or aorta? No, aorta.
This is aorta. I
Aorta,
told you. You
yeah.
see aorta between superior vena cava and pulmonary
Okay.
artery. Pulmonary veins, they enter the left atrium,
Yeah.
and you see them mostly posteriorly. Look, if you see posteriorly, the pulmonary veins are visible.
Okay.
What is this?
This one?
Mm-hmm.
This one superior vena cava.
Yeah, and what is this?
Pulmonary.
Why?
What why?
Why is it pulmonary? Look, which chamber of the heart it is.
This one is the right atrium.
So what is this?
Superior vena cava.
This is superior vena
Yeah,
cava.
inferior vena cava.
This is inferior vena cava, right?
Yes,
So you
yes,
see
yes.
it posteriorly. This is pulmonary. This is just so. First, orient yourself. Just don't throw out words. Be careful. Here, superior vena cava, pulmonary veins, and mainly visible posteriorly, aorta, pulmonary trunk. Let's go to the arteries and do the arteries. Do you remember we have coronary arteries? Where do we get them from?
From the coronary sinus, aorta.
Yeah, exactly.
From the anterior.
From the sinus.
Yeah, anterior cusps we have.
Yeah, the two anterior cusps. Very good. So look, we have. Be always careful. Check the apex. This is left side. Okay. We have left and right coronary artery from the anterior cusps.
Okay.
Right coronary artery is split into two. Do you see?
Yes.
It gives you anterior interventricular artery. This is anteriorly and between the two ventricle, anterior interventricular artery.
Okay.
And the other branch is called circumflex. Circumflex, do you know what does it mean? It means it goes around.
Yeah, sure.
So this is circumflex, goes back on the other side. If we now look at the heart posteriorly, which one is circumflex? This one or this one?
What?
If we look at the heart posteriorly now.
No, that one, the other side.
This?
Yes.
Why?
Because now we are on the opposite side.
This is also opposite side. Why? It's true, it's here, but why?
Yeah, because we said like it's circumflex at the pulmonary veins. So this side is the pulmonary veins.
What pulmonary vein?
Like go to the
No, okay,
first
so
lecture.
you mean in the left side?
Yeah,
yes.
left side.
Very good. Yeah, you're really clever, Abdullah. So from left side here, it goes to the other side. So this is circumflex. This circumflex, it gives you two branches. Look, left marginal and here, which ventricle it is?
Left ventricle.
Yeah, posteriorly, right?
Yeah.
It's called posterior left ventricular branch. So it gives you left marginal and posterior left ventricle.
Okay. So,
Okay. Okay, so the left coronary artery gives anterior interventricular and circumflex. Now, we mentioned the big branches. Let's look at the small branches. Anterior interventricular, it gives you another branch. Do you see here?
Yes.
It's called diagonal artery.
Okay.
So this is from anterior interventricular.
Okay.
Circumflex, we said it gives two big branches, left marginal and posterior left ventricular, right?
Yeah.
It also gives small branches.
Anterior.
Look, it goes toward the atrium, atrial branch.
Okay.
So where does the left coronary artery supply? You don't have to memorize, you can assume. If you memorize, it's really hard.
Yeah.
Where does it supply? Anterior part of left atrium and left ventricle.
Okay.
Also anterior interventricular septum. And do you see here? You also get a small branches to the anterior part of right ventricle.
Okay.
Posteriorly, where does it supply? Posterior part of left atrium, also a small posterior part of left ventricle.
Okay.
So you don't have to memorize.
Yeah.
When you see the artery, if you know how it runs, then you can look at the chambers and say. Okay?
Okay.
Now let's look at the right coronary artery. Right coronary artery, it gives this branch, it's called right marginal branch.
Okay.
It also gives SA branch. Do you know what is SA for? SA nodes.
Sinoatrial for
Yeah, SA nodes. It also gives atrial branch for right atrium.
Okay.
Then it goes posteriorly. When it goes posteriorly, as you said, this is in the right side. So when it goes posteriorly, we look at the right side. So this is right coronary artery. This is the marginal branch that we saw on the other side. When it goes posteriorly, here it gives posterior interventricular branch. So anterior interventricular is from left coronary artery, posterior interventricular is from right coronary artery. Yeah?
Just repeat the last thing you said.
Yeah. When it goes posteriorly, it gives posterior interventricular branch.
Okay.
So anterior interventricular artery, it's a branch of left coronary artery.
Coronary.
Posterior interventricular artery, it's a branch of right coronary artery.
Like it's the opposite.
Yeah.
Okay.
So do you see here, The
Yes.
posterior interventricular also give blood supply to the posterior part of left ventricle.
So it's diaphragmatic surface, right?
Yeah, this is diaphragmatic surface, this is sternocostal surface.
Okay.
Here, I tell you a clinical question.
Okay.
If there is necrosis in the posterior part of left ventricle, this is left ventricle posterior, it means here. And necrosis, it means lack of blood supply, blood is blocked.
Okay.
Which artery has problem? Which artery is blocked?
The left coronary.
No, right.
Right coronary. Right. Sorry.
Yeah,
Right.
because here we get supply from right side.
Right side.
Did you get it?
Yeah.
Because posterior interventricular, it also give blood supply to the posterior part of left ventricle.
Yeah.
Clear?
Yes.
Okay, these are the arteries. Let's go to the veins. And do you see here the groove here in the middle?
Coronary
Between
groove.
coronary. Okay, let's look at the veins. Now, the veins, we should collect the blood and drain it toward the heart.
Yes.
Anteriorly, in the left side, we have great cardiac vein.
Okay.
This vein is parallel with anterior interventricular artery.
Okay.
Great cardiac vein goes posteriorly. Now, where is it? Here, right?
Yeah.
This great cardiac vein joined with here. Vein of the, which chamber it is?
It's left atrium.
Yeah, left atrium. It's also called Marshall vein.
Okay.
And do you remember here, where is it? Posterior of left ventricle.
Yes.
So great cardiac vein with vein of the left atrium and posterior vein of left ventricle, these three together, they form a sinus which is called coronary sinus.
Okay.
Whereas coronary sinus is posteriorly between left atrium and left ventricle.
It's the sinus we said all veins drain into this sinus, right?
All the veins of the heart drain into this sinus. Okay? Then anteriorly we have a vein which is called on side small cardiac vein. This was great, this is a small.
Okay.
This one also goes posteriorly, look here, and drains into coronary sinus.
Okay.
What is left here together with posterior interventricular artery, we have middle cardiac vein,
Okay.
which also drains into coronary sinus.
Okay.
Then coronary sinus opens into,
Inferior vena cava?
seriously,
No. It's the atrium.
yeah, the right atrium. Do you
yeah.
remember opening of coronary sinus?
Yeah.
In the right atrium, we had also a valve, Tibesian valve.
Valve.
Okay. What is left here anteriorly of the right ventricle? Do you see these small veins?
Yes.
They're called anterior cardiac veins. They're the only ones which don't drain into coronary sinus. They drain directly into right atrium.
Okay.
Sure?
Yeah.
Good. Okay, so this was the
No.
blood supply. Let's look at the X-ray. They give you this X-ray and ask you questions.
Yes.
What is this?
This is clavicle.
Clavicle. First, which view it is? How did we take this X-ray?
Anteriorly.
Anterior, posterior, right? It's
Yeah.
PA. Okay, PA. Here, what is this?
What is this?
This is the scapula.
Scapula.
Yeah. What are these?
Ribs.
Ribs. What is this in the middle?
Sternum.
Huh?
Sternum.
No, it's vertebral column.
Okay.
Because you're taking picture of PA from posterior to anterior.
Okay.
What is this?
This abdominal or diaphragm.
This is diaphragm.
Yeah.
And what is this?
This heart.
Heart. Which side is the left side?
This one. The one this left side. This one.
You don't have to do. Imagine. Do you see the apex?
Yeah.
Apex of the heart is in the left side. So this is left. This is right.
All right.
Okay. The lines are black. Why? Because it's filled
full
with
of
air. It's filled with air, right? And
Yeah.
these are muscles and bones which shows in white because they can reabsorb. Okay, they give you this and you have to show which structures do you see. Here, which chamber of the heart it is?
Right ventricle.
No. Look. Look at this.
Okay.
What is here?
Is right atrium.
Right atrium. Here you have inferior vena cava, here superior vena cava. Where is right ventricle? Here, above diaphragm.
Okay.
This is left ventricle, and left atrium is really small because it goes posteriorly. Now when you look at the X-ray, so here this is?
Right atrium.
Yeah, here is superior vena cava as at the level of third costal cartilage, and here is inferior vena cava. Okay?
Alright.
In the left side, here you see arch of aorta, and a bit toward the left you see pulmonary artery.
Okay.
And this is left ventricle.
Okay.
You don't see really the left
Atrium.
atrium and right atrium. Do you see like it's mixed with diaphragm?
Okay.
So it's somewhere here. It's not really good visible. Okay? So in the right side we see right atrium, superior and inferior vena cava. In the left side, left ventricle, here is apex, arch of aorta and pulmonary artery.
Okay.
Good?
Good.
Yeah. In this picture, when they give you the X-ray, they can ask you about also projection of the heart. Do you remember?
Yes.
And projection of cardiac valves. So you theoretically talk about it, like where they are. Okay?
Okay.
So, do you have any questions?
No.
No? Okay. Let's go through the things which are left. First, we start with sympathetic trunk. Let me find a good picture in my book and search for the name. Okay, so this is right. A good picture is really important. Here, nerves of esophagus. Okay. Here. Is it good or is it blurry?
Very.
This is better. Yes.
Yes. Yes.
Okay. See? Do you remember we said for autonomic innervation we need two kinds of fibers, sympathetic and parasympathetic. You know that we get parasympathetic fibers for autonomic innervations of the organs in thorax from?
Vagus.
Vagus, very good. Now we have sympathetic fiber. You know, when we have the spinal nerves, spinal cord, this is neurology, you learn in neurology, okay? This is the cross section of spinal cord, okay? Then you have different parts. For example, you have in the thoracic part, we have ventral horn, dorsal horn, and lateral part.
Okay.
Yeah? Where do we get the sympathetic fibers in the body from? Which part of a spinal cord?
The dorsal one?
Huh?
This one here.
No, like generally, where do we get it? From which part of a spinal cord? Cervical, thoracic, lumbar, sacral, where?
I don't know.
I told you before, didn't I, that parasympathetic fibers are craniosacral. You get it from cranial nerves for upper part and sacral part of the spinal cord, lower part.
Okay.
Sympathetic fibers are thoracolumbar.
Okay.
For example, if you need sympathetic fibers in the neck, where do you get it from?
Thoracolumbar?
Thoracic part of the spinal cord. If you need it for thorax, still you get it from thoracic part. If you get it for abdomen, not abdomen, pelvis, for example, you get it from lumbar part, right? So where it is closer, it goes up or down. Here, if you look at the spinal cord, it has 3 parts. It's like, this is not a good picture, but just imagine we have anterior part, dorsal part, and lateral part, okay? From ventral root, we get motor fibers.
Okay.
From dorsal root, we get sensory fibers. And from lateral part, we get, for example, sympathetic fibers.
Okay.
One spinal nerve has all these 3 fibers.
Okay.
Okay? So here, do you remember when we have the intercostal nerves? Intercostal nerves, they communicate through great and wide rami with the sympathetic ganglions.
Yes.
With the sympathetic tract. So the fibers of when they leave the spinal cord, they make a trunk. How? First they form 12 ganglions, and these ganglions are connected through sympathetic fibers, so we have sympathetic trunk on each side of vertebral column.
Okay.
So sympathetic, I say it again, sympathetic trunk, it's made of 12 thoracic ganglions. Why 12? Because they're coming out at the level of spinal cord, at the level of thoracic vertebra. We have 12 thoracic vertebra, so 12 ganglions, right?
Right.
These are called paravertebral ganglions because they're parallel with the vertebral column.
Okay.
Where can you find these ganglions? Close to the head of the ribs. Okay?
Yeah.
So first we have 12 ganglions. These 12 ganglions are connected together through interganglionic segments.
Okay.
When they connect, so they form a trunk. This is called sympathetic trunk.
Okay.
Okay?
Okay.
What happens after? Here, if you need any sympathetic fiber in the thorax, you get it just from ganglion 1 to 5.
Okay.
That's it. So when you say we have pulmonary plexus, parasympathetic fibers from vagus, sympathetic fibers from ganglion 1 to 5.
Okay.
Pulmonary plexus, aortic plexus. Here we have around aorta, give innervation or regulate aorta.
Okay.
esophageal plexus. All of them are the same thing. Okay, so we have different plexuses which made of para and sympa. Para is vagus, sympa is from ganglion 1 to 5.
Okay.
What happens to the rest of ganglions? Look, till here is 5.
Yeah.
Okay, 6, 7, 8, 9, 6 to 9. Do you see they're connected together?
Yeah, and
they form a nerve which is called greater splanchnic nerve.
Okay.
Okay, so where do you see this nerve? In posterior mediastinum.
Okay.
Okay, so this was 6 to 9. Then 10 and 11, they form lesser splanchnic nerve.
Okay.
And 12 gives you lower splanchnic nerve.
All of
So
this we say it in the posterior mediastinum, right?
All of them, you see greater and lesser for sure, but lower it's not really visible.
Okay.
I mean, you can check, but I haven't seen because it's small.
Yeah.
Okay, and they don't cut so loud till the upper part of abdomen.
Yeah.
But greater is for sure visible. Lesser, it depends how loud they cut.
Okay.
And you see in posterior mediastinum. So what is greater splanchnic nerve?
6 to 9.
Ganglion 6 to 9. Their fibers, they join together and it forms a nerve called greater splanchnic nerve.
Okay.
What kind of fibers is it carrying greater splanchnic nerve?
Sympathetic.
Very good, sympathetic fibers. If they ask you what is the function of these nerves or where do they go, they bring periganglionic sympathetic fibers for the organs in abdomen. So they go toward the abdomen, bring sympathetic fibers for the organs in the abdomen. They do nothing in thorax.
Okay.
Clear?
Yeah.
Okay, good. Now let's talk about different plexuses. For example, esophageal plexus.
Okay.
How is it made?
Sympathetic from ganglions 1 to 5, parasympathetic from vagus.
Exactly. And do you remember we said here we have white and gray rami.
Yeah.
It's a branch of intercostal nerve which communicate with the sympathetic. White one, it's like periganglionic.
Okay.
It joins ganglion to the corresponding nerve.
Okay.
Okay? Gray is like postganglionic, joined the ganglion to a nerve.
Okay.
Okay? So first we have peri, and then it goes to the ganglion. After it leaves the ganglion, it's called post.
Gray.
Yeah, which is gray.
Okay.
Okay, and they communicate with the spinal nerves.
Okay.
Here, if you look at here, we have pulmonary plexus on each side of the bronchus, between trachea and bronchi.
Okay.
Do you see? On both sides, we have pulmonary plexuses. How is it formed?
Same thing, ganglions 1
Exactly.
to 5 and vagus.
Here, where we have the aorta, we have aortic plexus. How is it formed?
The same thing, 1 to 5, vagus.
Exactly. Then we have innervation of the heart, cardiac plexus. This is a bit more complicated, okay?
Okay.
Take a paper, put a paper in front of you so you don't get confused.
Okay. Ready?
You ready? Good. So, right, put one flash. I need to turn on my camera. Okay, put one flash up, right, sympathetic. Put one flash down, parasympathetic.
Okay.
Okay, in front of sympathetic, right, superior cervical. So put 4 flashes in front of sympathetic.
Okay.
Superior cervical, then right, middle cervical,
Okay.
then right, stellate,
Okay.
and then right, thoracic, G1 to G5. Did you write it?
Yes.
Okay, then you have parasympathetic. Write vagus
Vagus.
and put 3 flash in front of it.
Okay.
And superior cervical cardiac.
Superior cervical.
Cardiac.
Okay.
Inferior cervical cardiac.
Okay.
And then thoracic cardiac.
Okay.
Now listen. Do you see here? For the innervation of the heart, do you remember in head and neck we have also sympathetic trunk?
Yes.
Yeah, and on that we have different ganglions. Do you remember superior, middle, and stellate ganglion?
It's the fusion between inferior and superior
And
thoracic.
very good, the upper thoracic. Yeah. So in the neck we have superior, middle, and stellate ganglion.
Yes.
Then in the thorax we have ganglion 1 to 5, G1 to G5.
Okay.
Yeah. Then parasympathetic we have vagus. Vagus give you 3 branches. 2 of the branches from neck goes down, and 1 of the branches is in thorax. In the neck they're called superior cervical cardiac and inferior cervical cardiac. It means they're in the neck. Cardiac, it means they go toward the heart.
Okay.
Okay, and then we have thoracic cardiac, 1 branch in thorax which goes toward the heart.
Okay.
Okay, now listen. We have to match this or join this together. The fibers from superior cervical ganglion in sympathetic,
Yeah.
and middle cervical sympathetic ganglion in the neck.
Yeah.
These 2 together, they bring sympathetic fibers.
Okay.
And where do you get parasympathetic fiber from? Superior cervical cardiac branch of vagus.
Okay.
This is 1, okay?
Superior cervical.
The first one of the vagus.
Okay.
Then can you tell, this is 1 plexus.
Yes.
The next plexus,
Stellate.
what do you have in sympathetic?
So it's stellate with the inferior
Stellate.
cervical cardiac.
Very good, very good. These 2 for middle plexus.
Yeah.
What is the third one?
Thoracic G1 to G5 with thoracic cardiac.
What does it mean, G1 to G5?
Ganglion 1 to 5.
Yeah, very good. We said we get sympathetic fibers in thorax just from ganglion 1 to 5. And then para is thoracic cardiac.
What?
Where do you get parasympathetic from? Which?
Vagus.
Yeah, which part of vagus?
We have 1 thoracic and 2 cervical.
So which one is for this one?
Last one, thoracic part.
Yeah, thoracic cardiac.
The first one we call the superior cervical, superior cardiac plexus.
So the first branch from sympathetic
Yeah, superior
was
cervical.
superior cervical sympathetic cardiac nerve. This is the full name.
Superior cervical sympathetic cardiac.
Which you get it from superior ganglion.
So, superior ganglion. Okay, yeah, superior.
Then from middle ganglion, you get middle cervical
sympathetic.
sympathetic cardiac.
Okay.
These 2 together, they bring sympathetic fibers.
Okay.
Parasympathetic is from superior cervical cardiac branch of vagus.
Okay.
This is superior plexus.
Yeah.
Then we go to the next one. Now you tell me.
Stellate.
Stellate gives inferior
cervical.
cervical sympathetic cardiac nerve.
Yeah. With
And then, where do you get parasympathetic?
inferior cervical cardiac.
Yeah, so these 2, they give you middle plexus.
Middle plexus.
What is the third one?
Thoracic G1 to G5 with the sympathetic cardiac with the thoracic cardiac parasympathetic vagus.
With a thoracic cardiac branch of vagus,
Yeah, branch
which
of-
carries parasympathetic fibers. This gives you inferior plexus.
Okay, inferior plexus.
Yeah.
Okay.
Okay. So we call all these three together cardiac plexus, superior, middle, and inferior cardiac plexus.
Okay.
Okay, but these are together put into two groups. One of them, like they're divided into superficial and deep.
Okay.
Where do you find them? Anterior to the bifurcation of trachea. Do you see here?
Yeah.
So on sides you have pulmonary plexus. Here, anterior to bifurcation, you have superficial and then deep cardiac plexus.
Okay.
Okay?
Alright.
And how do they give innervation to the heart? They accompany the vessels. Do you remember for the heart we have arteries, coronary arteries,
coronary.
branches. These fibers, they go through arteries
Okay.
to the heart and then they regulate the heart.
Yeah, autoregulation.
Sure?
Yeah, but I have a question.
Yeah.
Like superior, superficial, and deep cardiac plexus.
Yeah.
From where does it come? Like,
So do you remember all these plexus that we say they form superior, middle, and inferior plexus?
yes.
All these three together they form superficial and deep plexus.
Okay, like you mean the superficial contains
It's
the
more
three branches.
anteriorly deep. It's a bit behind.
Okay.
Do you know what's plexus?
Yeah, I know.
You got a lot of nerve fibers,
Yeah.
right? Superior, middle, and inferior plexus. These plexuses, where are they? So they're like they're, how do you say, they stay superficially and deep,
Yeah.
right? This is how they stay superficial and deep. That's why you call them superficial and deep cardiac plexus.
Okay.
But I don't think they ask you so much detail.
Okay.
But just know it, okay?
Okay.
You need it for final.
Okay.
Okay. I'm going to tell you some... Do you know if you need to know diaphragm for the self-control test?
I don't know. But there's no topic called diaphragm.
Yeah, there is no topic.
Yeah.
I mean, I usually do it for medics in thorax and for dentistry in abdomen. But let's do the clinical, some clinical first, okay? Then we go through topic list. Then if you were not tired, we go through diaphragm. Is it good?
Okay. Anyway, I'll ask my teacher.
Yeah, okay.
Okay.
So let's do some clinicals.
Like you're gonna say it, I have to write it.
I can also take pictures to and send for you if you don't have them. But I think you have them. You have clinicals.
Okay.
You know, the first one I'm going to talk about, it's in the lung.
Wait. Okay.
So after pleura, you have clinicals. Did you find?
I don't have a clinicals.
You don't? I send it to you.
Okay.
If I forget, text me, okay?
Okay.
But I write it now. Okay. First, we do the clinicals of the lungs. You know, aspiration of foreign bodies. What does it mean? If you a foreign body, like something,
Yeah, they goes to the right
go to the
bronchiole
trachea.
because it's...
Very good, right one. Because right one is
It's
more
bigger.
vertically and wider.
Okay.
Okay. Injury to the pleura.
Okay.
Let's bring a picture of lung. You see here, pleura, where you have the apex, it's in the neck and it's really close to the first rib.
Cupola.
So fracture,
Cupola.
Yeah, cupula.
Yeah.
Fracture of the first rib can damage the pleura. If pleura damage, air can accumulate into this cavity, in the pleural cavity.
Okay.
When you have air in the pleural cavity, it's called pneumothorax. So they ask you, what is pneumothorax? It's accumulation of air in the pleural cavity. How can it happen? Like, for example, because of damage to pleura.
Yeah, damage of the first rib.
Yeah.
Alright.
Okay, so pneumothorax is air. If here, instead of air, we have accumulation of blood in the cavity because of damage to the blood vessels, this is called hemothorax.
Okay.
Hemo means blood.
Yeah.
Okay. Then we have something. Have you ever seen, like, they take samples from the... Like, how can they take sample to see what is accumulating in the cavity? They insert needle to superior border of ninth rib in the intercostal space and in mid-axillary line. It means if you go in mid-axillary line in the 9th intercostal space, it means between which ribs?
9 and 10.
Yeah, you go, and then in which cavity are we?
What do you mean?
Costodiaphragmatic
okay.
recess. Then if they take sample from here in the cavity, they can see what is in the cavity. Is it blood? Is it water? Is it pus?
Like, I want to ask you, why the 9th one, the 9th intercostal?
Because if you go upper, then you touch the lung.
Oh, okay.
Okay? Good. But if you look anteriorly, here, and they want to remove something anteriorly, okay? Where can they insert needle? In the 6th intercostal space, between 6th and 7th rib, here.
Okay.
So anteriorly it's here.
To remove something like what?
Like, for example, air, blood.
Okay.
Do you know what is pleuritis? Whatever has tis is inflammation. Inflammation of pleura is called pleuritis.
Yeah.
And the symptom is like sharp pain, especially when the patient go up from stairs or their respiratory rate increase. They feel sharp pain. Okay. Auscultation of the lung. How do you listen to the lung? With a stethoscope, right?
Yeah, stethoscope.
And when you listen, if it is filled with fluid, the sound is dull.
Yeah.
Right?
Yes.
Okay. Do you know what is? These are not so important, but atelectasis, it's for, they don't ask it. This is pulmonary embolism. Embolism is obstruction of the arteries when the arteries are blocked.
Okay.
This is important. Pleural pain.
Okay.
What pain in the pleura, like, where do you feel it? What is the innervation of pleura here anteriorly? Which nerves?
The pleura. The intercostal nerve.
Intercostal nerves, okay?
Yeah.
So and what about here medially? Which nerve innervates mediastinal part of pleura?
Is it a phrenic nerve?
Yeah, phrenic nerve. And we have something which is called referred pain. For example, have you heard if you have pain in the left arm, there is something wrong with your heart?
Yeah.
This is referred pain, okay? For pleura, we also have referred pain because anteriorly it is innervated by intercostal nerves. So if the problem is here, you feel the pain in thoracic and abdominal wall because the nerves also innervate thoracic and abdominal wall.
Okay.
Okay, but if the problem is mediastinal part, the innervation is through phrenic. Where do you get the phrenic from? C3 to C5 in the neck.
Okay.
So where is the pain? Your pain, it will be shoulder pain.
Okay, shoulder pain.
Yeah, you feel the pain in the shoulder.
Okay.
Okay, let's do the clinicals of the heart.
Okay.
We have coarctation. Coarctation, it means narrowing. For example, coarctation of aorta, when the aorta is narrow.
Okay.
When the aorta is narrow, what happens?
Like more blood.
So exactly. So the ventricle should try harder. The left ventricle.
Yeah.
Right?
Yes.
And sometimes it gets big because it's tried really hard. And if it is really narrow, then the blood cannot pump to the lower part of our body.
If it's narrow?
Huh?
Can you repeat?
Yeah, just imagine the aorta is narrow, right?
Yes.
When
I'm not hearing you.
So hear me. Is it good now?
Yes, now it's good.
Okay, so coarctation, it means narrowing.
Okay.
Okay? Aneurysm, it's opposite, it means dilation.
Okay.
We can have aneurysm of coronary artery, dilation of coronary artery. We can also have aneurysm of the heart, it means dilation of the heart. It's mainly happen in left ventricle.
Okay.
Because it carries the most amount of the blood, like it has the most amount of pressure, I mean.
Okay.
Cardiac tamponade, they ask this dude, what is cardiac tamponade? It's when the blood is in pericardial cavity. Do you remember between parietal and visceral pleura? And so when the blood accumulates in the cavity, it can be because of trauma, or it can be because of rupture, inflammation, anything.
Yes.
Then we have septal defect. Do you remember between atrium we have interarterial septum. Between ventricles, interventricular septum.
Okay.
Yeah? Sometimes parts of these septums are open. The blood can communicate between the two chambers. They should be surgically closed. It's called septal defect.
Okay.
And you know the disease of the heart valves, right? In physio, stenosis and insufficiency.
Yeah.
A stenosis, if it is narrow opening, so it cannot open well. Insufficiency is incomplete closure.
Yeah.
It can't close well.
Yes.
Yeah?
Yeah.
Okay. So now let's look at the topic list and see what is missed in each topic. Do you have the topic list?
Yeah, I have it on my iPad.
Okay, open it.
Vertebral column.
Thorax. Okay, the first one, it says vertebral column, okay?
Yeah.
So I said quickly what you should talk about.
Okay.
Vertebral column is made of different vertebra: cervical, thoracic, lumbar, sacral, and coccyx. Then you talk about number of each.
Okay.
Then you talk about shape of each and what are atypical and typical vertebra.
Yes.
You can talk about joints of the vertebral column, joint between body, between articular surfaces, in the thorax, between vertebra and ribs.
Yes.
And then also talk about ligaments, type of joints. This is about vertebral column. In this topic, they can ask you about curvatures. Do you remember lordosis, kyphosis?
Yeah.
So don't mention it, they will ask you.
Okay.
Okay?
Okay.
Then bones and joints of thoracic wall. Bones of the wall, we have sternum and ribs. So parts of the sternum, ribs, true rib, false rib, floating rib, then typical and atypical rib, shape of the ribs, parts of the ribs like head, neck. Do you remember? Yeah. And then here they can also ask you about a sternoclavicular joint you learned from upper limb.
Yes.
Yeah? So can you, like, it's a synovial type of joint, saddle type, and the ligaments, you don't have a lot of ligaments. You have some ligaments, it's easy to memorize. If you look at your book, you have interventricular ligament and sternoclavicular ligament.
Do I have to know the origin and insertion of the ligament?
Like interclavicular ligament is between the two clavicle.
Yes.
Costoclavicular is between costoclavicular rib and clavicle.
Yeah, but I mean in all the others, the one.
In all the others, for example, what do you have? You have, for example, intertransverse. It is between the transverse processes.
Yes.
Superior costotransverse. I told you it goes horizontally between transverse process of the joint, and then it runs to the lower rib. Costotransverse, rib and transverse process.
Okay.
Lateral costotransverse. It goes horizontally, right?
Yes.
From their names, it's obvious.
Okay.
So you should know. Okay, for example, if they say, what is originalization of costotransverse? You say, I don't know. It means you don't know what you're saying. Costotransverse, rib to transverse process. Okay? Joints of thoracic wall. So you have joints between parts of sternum, manubriosternal, xiphisternal. They can ask you about sternoclavicular, and then you have joint between cartilages and sternum, sternocostal, then costochondral between ribs and cartilage, and interchondral. Do you remember interchondral?
Yes.
Just between cartilage of the false ribs which attach to the seventh rib.
Yes.
So do you see a lot of topics from the first lesson that you don't like?
Yeah.
Fascia and muscles of thoracic wall. First, you talk about muscles, okay?
Yeah.
We divide them into axio-appendicular muscles and muscles of thoracic wall.
Yeah.
For muscles of thoracic wall, like intercostal muscles and transverse thoracic, this one you see. So you mention these first.
Yeah.
Serratus posterior, levator costarum, don't mention this. Okay? That was just for in case. So just mention the ones that you see.
Okay.
For muscles of thoracic wall, that like second group, intercostal, transverse thoracic, I told you origin, insertion, and innervation.
Yes.
Axio-appendicular, pectoralis major, minor, serratus anterior, and calarius muscle, they're from upper limb.
Yes.
They get their innervation from brachial plexus.
Yes.
Pectoralis major and minor, they're pectoral nerve. You get from brachial plexus.
Yes.
Serratus anterior is like thoracic nerve, again from brachial plexus. Subclavius is also from brachial plexus. These ones, they can ask you origin and insertion, and you're supposed to know because you learn in upper limb.
Okay.
So what do? You have more, right? Clinical anatomy of more.
Yeah, I wrote it, don't worry.
Exactly. So you open that, you read origin, insertion, innervation.
Okay.
Okay, oh, here it says axio-appendicular muscle. Do you see?
Yeah.
So here, muscles of the thoracic wall are intercostals, the three, external, internal, innermost, plus transverse thoracic. Axio-appendicular, no origin, insertion, innervation from the table.
Okay.
Blood supply, lymphatic drainage, innervation of thoracic wall. What do we have? Which artery? Internal thoracic gives 1 to 6 anterior intercostal, then divide exactly. Lymphatic drainage of the wall. Do you remember we talked about lymphatic drainage of breast?
Yes.
right? The wall, if you look at the thoracic wall, here. Do you see?
Yes.
When we have the wall, medially they drain into these nodes. They're called parasternal nodes. Okay?
Yeah.
Laterally, they drain into axillary nodes, which we divide them into 5 groups. Do you remember?
Pectoral and lateral, then central, then apical.
Yeah. First we had anterior, posterior, and lateral.
Yeah.
They drain into central, central into apical, apical. Then if it is right side, right lymphatic trunk, left side, left thoracic duct.
Okay.
And these two, they open into angulus venosus.
Yeah, angulus venosus.
Okay. Then mammary gland. We talked about breast. Parts of breast, lymphatic drainage, innervation, right?
Yes.
Here they asked, you remember we talked about ligament of Cooper. They connect the glands into the dermis.
Yes.
They ask, what is this ligament? Connect the mammary gland into the dermis, to the skin. Okay? Okay, trachea and esophagus. Trachea, you should say, it's the continuation of larynx after level of C7, made of the cartilage, ring shaped. You have the notes, right?
Yeah.
And in the notes, it's divided into cervical and thoracic part.
Yeah.
You can also talk about it in the neck. If you don't know it in the neck, like we have thyroid gland, inflammatory, blah blah, then just talk about it in thorax, that at the level of angle of Lewis is divided into 2 main bronchi. In the notes you also have blood supply for the trachea. Okay?
Yes.
And say that it's from neck enter into superior mediastinum, but we don't have it in inferior, whatever we said.
Okay.
Esophagus is continuation of pharynx after level of C7, made of muscles. And you know the muscles, have you learned in histo, the upper part is a skeletal, then it's mixed, then it's a smooth.
Yes.
Yeah?
Yeah.
Okay. And then innervation, blood supply of esophagus, esophageal artery from descending aorta, esophageal plexus, all of this.
Yes.
Then it's a bit lateral, it's a
Wait,
bit go
1
to
minute.
the left.
Just wait 1 minute. Yeah, sorry.
It's okay. And then turn a bit to the left. On top of it we have left vagus, behind it we have right vagus.
Okay.
Surface projection of the lung and pleura. So first you talk about lung. What is surface projection? Do you remember we said apex is cupula, 2 to 3 centimeter.
Above the clavicle, we have
exactly. Then
mediastinal.
It goes medially.
Yeah, mediastinal, and we have the.
Do you remember we said it goes medially? So you have to say it exactly.
Yeah.
In mid-sternal line till level of 6-3.
Yeah.
Do you remember?
Yeah, 6,
Left
6, 7,
one,
8,
it gives
8,
cardiac notch. Here they ask it. Do you know Thomas? She asked it. How far it is from sternum? If it is pleura, it's almost 2 centimeters. Say almost.
Okay.
If it is line, it's a bit more. It's 4 centimeters, for example.
Okay.
Okay? And we went through projection, so you have to tell them exactly.
Okay.
Then pleura and pericardium. So you say pleura and pericardium.
Yeah.
Pleura is a serous membrane, 2 layers, parietal, visceral. You can hear also again talk about projection of parietal pleura.
Yes.
and then it has the same blood supply, innervation, venous drainage as the thoracic wall, right?
Yes, visceral about the same as the lungs.
Lung, very good. Between these two, we have cavity. The cavity has three
fluid
recesses, which the lung can expand into this recess.
Yeah, wow.
Then,
God.
huh?
Yes, yes.
Yeah. And do you remember we talked about the segments in the lung?
Yeah, we have 10 segments.
Exactly. You know, I told you the segments can be surgically removed.
Yeah, surgically removed.
Yeah?
But do we have to know the names?
Ask, huh?
Do we have to know
I
the
don't
names?
think so.
Oh, because
Okay.
yeah, okay.
Your teacher say yes?
Like in the lecture, they say you don't have to memorize it. You said like maybe some examiners won't.
But in the lecture, if they say you don't have, then you tell your examiner. If they ask, then they don't. If they ask, you say in the lecture they said you don't have to. Okay?
Right.
But do you see here, when we have segment, a segment can be surgically removed. Why? Because pulmonary artery and their branches, this is pulmonary artery in the middle, and these are pulmonary veins.
Yes.
Pulmonary artery and branches are distributed segmentally.
Okay.
And pulmonary veins are intersegmentally,
Okay.
between segments. So you can easily remove one segment. There would be no bleeding. Do you see?
Yes, yes.
So you say because the pulmonary arteries and branch are distributed segmentally. Okay. Pericardium. It's a fibrous serous membrane. First you talk about fibrous pericardium, then serous pericardium.
Yeah.
They can ask you about pericardial tamponade. I send you the clinicals. It's when the blood, I told you, accumulate in the cavity.
Okay.
Then you have a lung. They give you the lungs. You have to talk about surface, hilum. What do you have in hilum? Impressions of the lung.
Yes, yes.
Surface projection and radiograph view of the heart. They give you the X-ray. You have to show the structures that we saw.
Okay.
Then they ask you also about surface projection of the heart. Do you remember we had 4 points?
Yes, 4 points.
Yeah, so you talk about those.
The projection, not the outlines, right?
No, projection. Don't memorize the outlines, just the projection.
It's the same. It doesn't.
It's a bit different, okay?
Yeah, but no problem. Okay.
Then surface projection of the valves, where the valves are.
Okay.
Here they can also ask you about auscultation of the valves.
Auscultation. Okay.
Okay?
All right.
Fibrous skeleton and chambers of the heart. Fibrous skeleton.
Yeah,
we said
annulosis, fibrosis.
Yeah, exactly. So 4 rings, 2 trigones, 1 ligament, right?
Yeah.
And what is it for? Attachment of the
attachment of muscles,
attachment
of the
of the muscles, separate atrium from ventricle.
Yeah.
Chambers, we have 2 atrium, 2 ventricles. Between the 2 atrium, you have interarterial septum.
Yes.
Between the 2 ventricle, interventricular septum.
Musculus and membranous part.
Exactly. And between atriums and ventricles,
we have
AV valves.
Yes.
And then you show the structures that we saw.
Okay.
Okay? Orifices and valves of the heart. Okay?
Okay.
So here you talk about valves of the heart and the openings of superior vena cava, inferior vena cava. You show the structures and the valves. We divide the valves into cuspid and semilunar.
Semilunar, yes.
Vasculature of the heart. It was today's lesson.
The
arteries and veins. They give you the sample. You have to do arteries and veins.
Yes, stimulating and conducting the SA and AV node.
So stimulating is SA and AV node.
Yeah,
conducting is his bundle and then right and left bundles and Purkinje fibers.
Okay.
Regulating is sympathetic and parasympathetic fibers, which decrease and decrease the heart rate.
Okay.
Okay?
Okay.
Then conception of mediastinum, the thoracic cavity is divided into a median portion, which is called mediastinum, and two laterally pulmonary cavities.
Okay.
Then you also talk about border of mediastinum, then how it is divided into superior and inferior.
Yeah, the coronary discipline from the sternal to the...
Yeah, Abdullah, the big problem, you're really clever. The big problem is that you don't pay attention to the words. What is coronary plane?
No, not the coronary. I have to revise, don't worry.
Yeah, transverse thoracic plane,
Yeah,
okay?
yeah.
So be careful about the words.
Yes.
Then parts of mediastinum. So first is divided into superior and inferior. Then in the inferior one, because you have heart, you have anterior, middle, posterior.
Yes.
Then structures of superior mediastinum, we put them in layers, thymus, big veins, blah, blah, blah. And you have to show all of them.
Okay.
Again, same thing, but structures of posterior mediastinum, azygos, thoracic duct, sympathetic trunk. Here you can also see splanchnic nerves.
Okay.
If they ask what do, nothing in thorax,
But
they
go
carry the fibers to the abdominal
Yeah.
organs.
Yes.
Okay? Here we have autonomic innervation of organs of thorax.
We
you
talked,
say we
yeah.
need... Huh?
We need vagus for parasympathetic.
So,
we need
exactly.
sympathetic from ganglion 1 to 5 for the... for sympathetic.
Yeah. Sympathetic, and they form plexuses. And
Yeah.
what are your organs? Esophageal plexus, aortic plexus, pulmonary plexus, and cardiac plexus.
Okay.
Okay, then we have this one left, lymphatic drainage of thoracic organs.
Well, we have the thorax duct, which is drained.
So first we should do it one by one.
Okay. You mean I have to talk about the memory?
We do it now. Like we make a summary for everything. All the organs, all the lymph nodes that we have.
Okay.
Okay? So here first we have breast.
Yes.
We talked about lymph nodes of the breast, right? Medially they drain into parasternal loss here.
Yes.
And then if you remove the rib cage along with internal thoracic artery, we have internal thoracic nodes.
Okay.
So here we have internal thoracic nodes.
Okay.
Okay. From above diaphragm, we have diaphragmatic nodes. So from upper part of... Wait. So if you get this topic, you have to mention the organs one by one, talk about lymph nodes, okay?
Okay.
For the lung, we talked in detail what happened.
Okay.
Do you remember?
Yeah.
Yeah. For diaphragm, above the diaphragm, we have diaphragmatic nodes. Okay? For the lung, I say in general, for the lung, trachea and heart, we have tracheobronchial nodes.
Yeah, I remember, but in the class she said there is no parasternal. Like when she said the pathway, she skipped the...
Parasternal, paratracheal.
Paratracheal, sorry.
She said there is no...
No, she didn't say there is no, but she skipped it, when she said the
okay.
pathway.
If she skip, it's okay.
Okay.
You can also skip, it's okay.
Okay.
Okay, in some of my notes also it's a skip, it's okay.
Okay.
So, from lung, trachea and heart drains into tracheobronchial nodes.
Yeah, tracheobronchial.
From esophagus and pericardium behind this, it drains into posterior mediastinal nodes because esophagus is in posterior mediastinum,
Yes.
right?
Yes.
Yeah.
Where does the posterior mediastinal lymph node drain into? Thoracic duct?
Posterior mediastinal nodes, all of them at the end they collect, drain into thoracic duct.
Okay, but
So
if we are on the right side,
in the right side,
They drain into the right lymphatic duct, then into the angulosus venous.
Like it depends where you are, okay?
Okay.
If you're here in the upper part, yes, they drain into right lymphatic tract.
Okay.
But if you're here in the lower part,
Yeah,
they
thoracic duct.
everything we said third, fourth in the left side drain into
thoracic duct. Then thoracic duct goes to the left side to the
left angulus venosus.
Yes.
Yeah. So you know, I make a list with the name of the organs and the lymph nodes that it drains to. Okay.
Okay.
You say the name of the organ, the lymph node, and then you say at the end, all of these they go third, fourth of the body.
Okay.
So it means the thorax in the left goes through the left thoracic duct and empty into left angulus venosus, and one side, 1/4 in the right, empty into right lymphatic. I also draw you a picture so you see which part of thorax is exactly into right lymphatic tract.
Okay.
Okay, but I think it would be good. We don't go through muscles of diaphragm like origin and insertion, but we go through which structures pass diaphragm. Okay.
Okay.
Because muscles for sure they don't ask. But how does the topic list look like?
Yeah, it's okay.
Sure.
Yeah.
But still, if you study and you see that you have any problems, so text me, okay? I can come online and we do something together.
Okay.
Now, let me find a picture of diaphragm. So what do you think? What are the structures which need to pass through diaphragm?
Azygos, hemiazygos.
So look first. Here, do you see? You're looking. It's the cadaver. This is lying down.
Yeah,
the abdominal organs are removed. It means you're looking from abdomen toward the thorax.
Inferiorly.
Inferior. So do you see diaphragm on the sides? It has a muscular part.
Yes.
And in middle, it has a tendinous part. It's called central tendon.
Okay,
Your
central
heart
tendon.
from
central.
above, it's resting on central tendon.
It's diaphragmatic.
So do you see the heart is resting on the tendon, not on the muscles.
Yeah.
The lungs are on the muscular part. On sides here, you have lung from above. The lung is sitting on muscular part. The heart is sitting on the central tendon.
Okay.
Clear?
Yes.
So what are the structures which pass through diaphragm? Inferior vena cava, very good. Goes and enter to the thorax. What else?
Azygos.
Azygos, we said we have ascending lumbar veins,
ascending
right
lumbar.
and left. With through diaphragm, they change their name when they go to the thorax. Right one is called azygos, left one is called hemiazygos.
Yes.
What else?
Esophagus goes to the stomach on the left side.
Structures passing diaphragm. Okay, let's find a picture. It's better for you too.
And we have the today's one is splenic, greater and lesser.
Very good.
Yeah.
Okay, look. We have, as you said, this is for inferior vena cava, okay?
Yes.
We have lumbar veins which change to azygos and hemiazygos. Very good. Today lesson is splanchnic nerve. They go from up down.
Yes.
Esophagus also from up down.
Yes.
Thoracic aorta or descending aorta. Now it's called abdominal aorta.
Okay.
Yeah. One more. Together with esophagus, we have a nerve.
Phrenic nerve.
It's attached to the esophagus. It's on top, on each side of esophagus, top and below. Vagus.
Okay.
So together with esophagus, we also have vagus nerve. Okay. So I should send you, what did you ask me to send? Clinicals.
Yeah, the clinicals.
And then the lymph nodes, right?
Yeah, lymph nodes.
Have you checked the topics of the heart? Was it good? Do you have everything?
Yeah, I have everything. Like the thing I don't have, I write it. No problem.
So
But
as a picture, so you can check if you want.
but not everything, like, in the notes you write a lot of things, like we don't go over them, but I have to go over them, right?
Over what?
Like there is some like especially in the first lesson, like some joints we don't go over them, but I have
Like
to
what?
go over.
Maybe it's been part of upper limb, like
Yeah,
that.
it's an upper limb, yes.
Yeah. But or maybe it hasn't been hard. It's been obvious what it is. Like for example, a sternocostal or costochondral or interchondral,
Okay.
like this.
Okay.
Do you mean these?
I don't remember, but just I'm asking you to make sure.
Yeah, I think it's been these. So you have to go through. Probably I forget, but look, they're not hard.
Yeah, they are not hard.
This one is sternocostal. It's here, and cartilage is chondral. Costochondral. Yeah.
Yeah.
And here between cartilages you have interchondral.
Yeah, intercontinental.
Yeah, this is synovial type of joint.
Okay.
But go through everything, okay?
Okay.
Also put a paper in front of you, put 15 papers in front of you, write one. So write for yourself, what should you say in each topic? Gather the notes. Now, you shouldn't just read. What should you do? This is the best thing. You should gather the information for each topic. Okay. Like in the vertebral column, make points. What should you talk about?
Okay.
In the next one, what should you talk about?
Okay.
And the things which you need to memorize, write it down on each paper.
Okay.
Do you do that?
Yeah. When
Promise.
I memorize, I have to write. This is my way.
Yeah, so write the 15 topics, and in any topic, if you saw you have problem or something, just let me know.
Okay.
Okay? And don't forget, check a Splanchnik nerve, check heart very well on Friday.
Okay.
And if it was any problem, you thought that you need more lesson, if it is something that is not clear, just let me know.
Okay.
Okay, sure? And let me know how your exam goes on Tuesday, don't forget. Is it Tuesday?
Yeah, Tuesday.
Yeah, okay. So good luck.
Okay.
And see you later, right?
All right.
Bye.
Bye.